Hello everyone, my name is Sukmeet Kaur and today I'm going to take you through an analytical journey into one of the most critical health concern of our time, the lung cancer. Through this storyboard, I will show you how different risk factors like age, smoking habits, environmental exposure, and access to healthcare play a role in predicting lung cancer outcomes. So let's begin. So lung cancer remains the leading cause of the cancer-related deaths globally, and early detection is essential for saving life. So, my main research question is how do demographic and exposure related factors influence the likelihood of lung cancer prediction in patients? To break this down, I explored four sub research questions. That is, what proportion of patients are predicted to have lung cancer? How do demographic factors like age and smoking status influence predictions? And how do geographical and environmental exposures affect diagnosis? And my last question is how does access to healthcare shape prediction outcomes? This study is exceptionally relevant to public health professionals and policymakers working on prevention and early intervention strategies. Then I begin with the high level overview. This KPI dashboard gives a snapshot of key statistics. The 20.3% patient in data sets are predicted to have a lung cancer. That's 1 in every 5. And the average age is 60. And around 33% of individuals are current smokers. And the average mortality risk is just about 50.1%. So these figures set the stage for why this analysis is so urgent and important. Then we look at the simple but powerful chart showing cancer prediction outcomes. Here, I found that nearly 80% of individuals are not predicted to have a lung cancer, but the remaining 20% represent a significant portion at risk. So, this is not just a number, it means 1 in 5 patients in this data set may be living with or developing a lung cancer. That's a call for action. Then we are looking at smoking status distribution. The data shows nearly equal number of counts among smokers, former smokers, and non-smokers, with over 153,000 people in each group. This variable is highly balanced. This distribution makes it very clear that smoking history is not only common but essential in predicting lung cancer. We then look at how the age relates to lung cancer risk. These charts compare the four age groups. The highest number of predicted cancer cases is 24,396, was seen in the 76 plus groups. But interestingly, the gap between cancer and no cancer prediction remains stable in the younger groups. This means that while risk increases with age, we need early monitoring across all age ranges, not just in seniors. Next, we then examine how air pollution and living environment influence prediction. This chart shows that urban residents constantly have a higher predicted cancer rates even at a low and medium pollution levels. Although cases dip slightly at high pollution levels, urban rates still dominate. This suggests urban living due to factors like traffic and industrial exposure at significant risk. Now take a global look. This map highlights top 8 countries with the highest predicted lung cancer rates. The South Africa leads at 10.9%, followed by Brazil, South Korea, and Myanmar. The presence of countries from Africa, Asia, and Latin America emphasize that lung cancer is a global issue, not limited to a specific region. Next, we look at the healthcare access. Interestingly, people with a better healthcare access have a more total diagnosis. But those with a poor access show higher relative risk. This suggests that in underserved areas, cancer is likely underdiagnosed or detected late. It shows how deeply healthcare inequality affects the health outcomes. Now that I have walked you through all the individual charts, I want to show you how I brought them together into two final dashboards. So this is my first dashboard which give a snapshot of key factors like smoking status, age distribution and the overall prediction outcome. It helps us quickly understand who is most at risk and how widespread the predictions are. And this is my second dashboard, which focus on environmental and healthcare related risk, highlighting how urban living, pollution levels, and limited healthcare access are linked to higher predicted lung cancer cases. Together, these dashboards summarize the story the data is telling. Smoking and age remain the strong predictors. And of course, the urban environment carry more risk even with the moderate pollution. And the limited healthcare access can hide the serious threats, leading to the delayed diagnosis. And what made these dashboards more powerful is their interactivity. I added the filter based on the lung cancer prediction status, cancer or no cancer. So when I click on cancer, all charts update and it show me the trends related to those who have predicted lung cancer. And when I switch to the no cancer, so I can instantly see the patterns for those who does not have a lung cancer. So what we learn from this analysis? First, the lung cancer prediction affects about 20% of the dataset, showing a real and urgent health burden. Older adults, especially those over 76, have the highest predicted cases, but risk exists across all ages. Current smokers still represent the biggest risk group, but former and non smoker are also at risk, likely due to secondhand smoke or environmental factors. Urban residents consistently show higher predictions, which highlights environmental risk. Lastly, those with poor healthcare access face higher risk, even if they have a fewer total diagnosis, suggesting a troubling trend of underdiagnosis. All of these findings come together to answer my research questions. Yes, demographic and exposure related factors, especially smoking, age, pollution, and healthcare access, significantly influence the lung cancer prediction. So, now what we can do with this information? We need to expand early screening to all age groups, strengthen anti smoking efforts, and improve healthcare access, especially for underserved populations. Urban environmental policies to reduce pollution are also essential. Looking ahead, future efforts should focus on incorporating personalized risk profiles like genetic or occupational history and improving data surveillance systems. International collaboration will be vital in developing the region specific policies. So, the data tells a clear story. Lung cancer does not have to be a silent killer. By acting now through awareness, policy, and innovation, we can rewrite the future for million at risk. Overall, this research not only answers the core question, it provides the direction. If we use the insights from this analysis, we can improve early detection, reduce disparities, and ultimately save lives. So thank you very much for listening this.